Hey everybody, we really appreciate you taking the time on this beautiful morning here to spend a little bit of time with us. I don't know if we saw any of you the last time we were here, but we're very happy to be back. To tell you just a little bit about ourselves, my name is Stacy Gallagher. This is Mike. Obviously, we are married, and we're business partners as well. We started our own company, which is called My Longevity Health Compass, about 7 or 8 years ago. So for about 46 years, Mike has been in the insurance industry, the healthcare insurance side of the world, and I was a clinician for 43 years. I was a registered nurse, a cardiovascular nurse. I still have a license, but I use it primarily for volunteer types of things now after joining Mike's practice. We are based in Colorado. We live in Colorado Springs. So we cover the entire state, from northern Colorado to southern Colorado and everywhere in between. We're actually licensed in 14 states, but we live here and we primarily focus our business here in Colorado. And one of the reasons, hopefully, that if it feels like this to you now, hopefully by the time we're finished, it'll feel a little bit differently. One of the reasons that we started our own company is because, as I told you about our backgrounds, and we always had similar but different stories. Having to get home from work and you're kind of rehashing your day a little bit. We had similar stories a lot of the times about having patients or clients, depending upon the nature of our roles, that had ended up making certain decisions about their health care and about their future with misinformation, ill information, or just not enough at all, and got misdirected. And sometimes you can reverse those changes, and sometimes you can't. Sometimes you might end up being stuck, for example, with a Medicare plan that really didn't fit your particular needs. The majority of people take recommendations about what path to take in Medicare from a neighbor, a sibling, or a workmate that doesn't really have any background in insurance or healthcare at all. But you figure, like, well, if it's good for my sister, it'll be great for me. So one of the things that you're probably going to hear us say a lot today is there's not a one-size-fits-all. There's a lot to know about Medicare in and of itself, and then the different paths that one has the opportunity to take to augment original Medicare if they so choose. And they are very different animals. So it's really about, our focus is really making sure that people understand the ins and outs of Medicare itself before they even start thinking about what direction should I go with a product to augment what Medicare does not cover, because there is a lot. People sometimes think it's not unusual where we come across people that think, well, now that I'm finally on Medicare, it'll take care of everything. And if you don't already know that, I hate to give you that news. But that's not really true. But there are things out there that will really help you with the type of coverage that you need and what you need and what fits your lifestyle, the way you like to access care. Do you travel? Do you care about keeping your providers and hospital systems, or is it not a big deal to you? All of those kinds of things really should be taken into account before you make those kinds of decisions. So we're going to encourage you to ask us questions anytime that you want this morning, and we'll try to be as succinct as possible. I mean, we can go on and on and on more than you'd ever want to hear, but we'll try to be as succinct as possible. And if something's not clear, please interrupt us because we want you to really understand, what we're trying to communicate here. So feel free to do that. So on that note, I will let you get started.
Okay. Thank you, everyone. It's great to be here. We're going to talk about transitioning from being an active employee to retiree. Not only when to enroll in Medicare, but how to enroll in Medicare. And we're going to also look at the different components of Medicare. There's a number of different areas, and we're going to go into detail of each one of them. And then finally, how do I fund or pay for my healthcare expenses when I do retire? We're going to share some ideas relative to that. So Medicare is a federal program, federal health insurance program for older adults, and it's designed to provide people with a lifetime of protection once they become eligible for Medicare. People may become eligible for Medicare prior to age 65 if you have a disability and you're receiving disability, SSDI disability benefits for 24 months, one can become eligible for Medicare prior to 65.
Can I ask a quick question?
Go right ahead.
Do we, once you turn 65, do you have to take Medicare?
Yes and no, and we're going to talk about those scenarios. People often confuse Medicare and Medicaid. Medicaid is a joint federal and state-run program that's available in each state, and Medicaid is designed for people with limited financial resources, and one must qualify for Medicaid as your secondary payer. But if you're eligible for Medicare, you still need to enroll in Medicare Parts A and B, which I'll be talking about.
And while we don't immerse ourselves in the Medicaid world, because it's, again, a whole completely different animal and a ton to know about that, we do know people in our industry that is their specialty, and we can refer people to them and vice versa. They have them help their Medicare people. And then there are people that, and you may know some, that are actually what we call dual eligible. They're eligible for Medicare and Medicaid. So we do have resources that can help people with that if they're looking for somebody that's an expert in either one.
Real quickly, when it comes to Medicare Savings Plan funded by Medicaid, people may qualify at 4 different levels. One of the levels will cover your premiums associated with Medicare Part B and Part D. And then there's one other level that is going to, if people qualify, fund not only your premiums, but deductibles and co-insurance that you may incur with Medicare. But our focus is going to be on Medicare. It began back in 1965. It's overseen by the Centers for Medicare and Medicaid Services. And there's been changes throughout the years with Medicare. And we're going to bring you up to date on some of those changes. For those of you who are nearing age 65, CMS publishes a Medicare and You guide. I encourage you to order that, or you can get a digital version online, and it'll
just like this,
provide
and I
some
put one in your folder. And so, as Mike mentioned, these are published by the Centers for Medicare and Medicaid Services, so it is a mutual resource. And this was in 2025. Usually these will come out the end of the first quarter or so of the next year. So we won't see 2026 versions until probably early spring, the end of the first quarter at least. But if all of you are not enrolled or a member of Medicare.gov, I encourage you to do that. You don't have to be a member to get some of the resources off of there, but it's just kind of a nice thing to have. Even when you're enrolled in Medicare, it'll remember your plans for you, your claims for you, and things like that. So it's kind of a very helpful resource. So those are available to download off that site. And then these are too, and some of you may already have one of these, or these also you can get off of Medicare.gov. It's a plethora of information about Medicare, again, published by the Centers for Medicare and Medicaid Services. There's a new version each and every year. And as you can see, the 2026s are out. You can download these off of Medicare.gov, or you can request a hard copy, what they call a print version. They kind of hide that now. It's kind of, you have to poke around in there to figure out how to get a print version. They used to automatically send them.
I got mine just sent to me.
Did you? Okay, well, that's good to hear. We don't hear that all the time anymore. But you can get them if you haven't been sent one off of their website. The difference between them, if it matters to you, is because it's a federal publication. So all of the content is the same except for the very back of the book. So that people that are interested or at least want to high level compare Medicare Advantage plans, we're going to talk about the difference a little bit later. But they have your state. So they are state specific, the very back part of this book. So if that's important to you, that's just something to know.
Okay. So when is one eligible for Medicare? You are eligible for Medicare unless you're disabled on the first of the month that you turn age 65. If your date of birth happens to fall on the first of the month, then you are actually eligible for Medicare on the first of the month prior to the month you turn 65. Can you go start Medicare when you go on Social Security? Yes and no. Understand that those are completely separate and independent programs with different qualification requirements. So there is opportunity that one can qualify and claim Social Security retirement benefits prior to age 65. So those are situations that occur. But Medicare has its own eligibility requirements, and I'll talk a little bit in detail about what those enrollment periods are. Generally, what I recommend is people enroll in Medicare approximately 2 to 3 months prior to when they want the coverage effective. It's going to take some time for Social Security Administration to administer and process that application. So I encourage people to do that 2 to 3 months prior to when they are eligible. If one retires prior to 65, can you go on Medicare? No, you can't. Medicare has its own eligibility requirements, so if you retire prior to 65, you may need to look at individual health insurance coverage. Maybe you're covered under a credible health insurance plan through an employer, through a spouse. There may be COBRA, continuation of coverage. Those are some things that you want to take into consideration as part of your strategy.
Unless somebody has a disability.
Right. People often ask, well, I plan to continue working, and many clients that we work with work past 65. Do you have to enroll in Medicare prior, or if you work past 65? That answer can vary yes and no. We're going to look at one situation. If you have credible health insurance coverage through an employer-sponsored plan, you'll be entitled to a special enrollment period where you can enroll in Medicare at a later date if you have coverage through an employer-sponsored health plan. One of the things to remember is that if you are past 65 and you don't have employer-sponsored health coverage, maybe you have an individual plan or a Medishare plan, those are not considered credible coverage by Medicare. So it's important to understand that. If you go on Medicare, what happens to your spouse or any dependent children? Medicare is an individual-based coverage program. There's no such thing as family coverage when it comes to Medicare. So people need to qualify based on their own eligibility requirements. So if you're covering a spouse, you may need to look at other options for him or her as it relates to your coverage and protection. When you enroll in Medicare, you actually do that through Social Security Administration. And you can go on to the ssa.gov website. And if you haven't established a My Social Security account, you will need to do so, creating your own username and password. But you can enroll online by creating that account for Medicare. Going on that account doesn't require you to enroll and claim benefits for Social Security. You'll see a separate tab where it says enroll in Medicare, and one may do that. So should I enroll in Medicare? Well, as I mentioned, if you or your spouse and are currently working and you have credible health insurance coverage through an employer-sponsored plan, you may delay your enrollment in Medicare. You're not required to enroll, and you will not incur a late enrollment penalty as long as you have credible health insurance coverage through that employer. You will have a special opportunity to enroll in Medicare when you do decide to retire and you no longer have that health insurance through the employer-sponsored plan. And as I touched on, you need to or want to make sure that your family has protection if you're providing the health insurance protection through your employer, and make sure that you have the appropriate strategies in place in terms of timing and so forth. So signing up for Medicare Part A, that is the hospitalization. If you are claiming retirement benefits from Social Security at the time that you turn age 65, Medicare will automatically enroll you in Medicare Part A. You don't have to proactively enroll yourself. But if you're not claiming retirement benefits, you must proactively enroll yourself in Medicare Part A. For most of us, Medicare Part A will be zero premium. As long as you have worked at least 40 quarters or 10 years during your career and contributed into FICA and Social Security tax, Medicare Part A will be zero premium. One of the things that I like to mention is people say, well, I've got credible health insurance coverage through my employer. I'm not going to enroll in Part A. There's only one good reason not to enroll in Part A. If you are participating in a health savings account and are making new contributions to the HSA, you may no longer make new contributions once you enroll in Medicare Parts A and or Part B. So if that is part of your strategy where you're making contributions into an HSA, then you would not want to enroll in Medicare Parts A or B if you wanted to continue making those contributions.
And one of the reasons we say that that's the only good reason not to enroll in A is because A, it's hospital insurance, and we're going to talk in detail about what's an A, what's a B, and what's a D, but it can become a secondary payer to what your other health plan is, that Part A if you're hospitalized or whatever. So that's one of the reasons we say there's no reason not to, unless the HSA situation comes on, because it does have the potential to become a secondary payer.
If you happen to work for an employer who has fewer than 20 employees and you become eligible for Medicare, Medicare will be the primary payer. The group plan, if you're continuing to work, will be the secondary payer. If you're working for a larger employer, then the group plan becomes the primary payer and Medicare is your secondary payer. So those are some differences there.
Mike, we do have a question online, and it's, can a spouse delay enrollment in Medicare Part B if they are part of their spouse retiree health insurance plan?
Yes, they can.
Says the credible health insurance plan does not appear to apply to a retired spouse employer-sponsored health care plan. COBRA and retired benefit plan is not considered credible.
Correct. The one thing is that depending upon the employer, to participate in the retiree plan, you would want to check with that employer's HR to see if they require that individual to be enrolled in Medicare Part B. So it may vary based on that, but oftentimes the employer will require that individual enroll in Part B in order to be associated with that retiree health benefits of that employer. Okay. Enrolling in Medicare Part A, which is hospitalization, there's really 3 enrollment periods. There's your initial enrollment period. That applies to individuals who are turning age 65. You have a 7-month window that begins 3 months prior to the month you turn 65. It includes the month of your birth, and 3 months after turning 65, where you may enroll in Medicare Parts A and B and not be subject to any late enrollment penalty. Another enrollment period, let's go to the third one, special enrollment period. For those individuals, as an example, who elect to work beyond age 65, and they decide, I'm going to stay with my employer group plan and I'm not going to enroll in Medicare, you have a special enrollment period whereby once you lose your group coverage, you decide to retire, you have up to 8 months to enroll in Medicare without it being subject to a late enrollment penalty. We'll get into some strategies about that, but Medicare Part B typically has a premium associated with that, and that's why people may want to consider delaying their enrollment in Medicare Part B if they have access to health coverage through an employer-sponsored plan. We encourage people to do a cost-benefit analysis, or that's one of the things that we provide to our clients, where we'll look, depending upon your employer plan may be very comprehensive, good value, and low cost to you. In other cases, depending upon the employer group health plan, we may find that Medicare is a better value for that individual. It really takes a little bit of analysis to understand that. But you do have that special enrollment period. When you decide to retire if you're over age 65. There's also what they call a general enrollment period. For individuals who elected not to enroll in Medicare during their initial enrollment period or special enrollment period, they may enroll in Medicare Parts A and B between January 1 and March 31st of each year, and coverage will become effective on the first of the following month that you submitted your application. Now, if you're enrolling in Medicare during the general enrollment period, you could be subject to a late enrollment penalty depending upon your situation. We want to avoid a late enrollment penalty because if you incur that late enrollment penalty for Medicare, it's going to stay with you for your lifetime. It doesn't go away. So just be aware of that when it's appropriate, either in the initial or special enrollment period, that's when you can enroll and not be subject to the late enrollment.
Does that also include the Medicare Part B?
Yes.
Okay,
When I'm using the term Medicare, I'm saying that in general.
okay.
Yes. You will have penalties associated with Part B as well as Part D.
Okay.
Okay, if one is receiving Social Security benefits, Medicare and Social Security will automatically enroll you in Part B. And coverage will become effective on the first of that month. Medicare does not have middle of the month's effective dates. It's the first of the month. So that's why I suggest time it so that you're applying 2 to 3 months prior. If you don't want Medicare Part B because you have employer coverage through yourself, your own employment, or a spouse, you can delay your enrollment in Medicare Part B and basically delay paying premiums to Medicare Part B.
In fact, online, you can just type that in, and there's a box where you can make requests or state certain things. You can actually put in the date that you want B to be effective. And you don't have to even put in a date, you just said, I don't want B right now, just A.
And in general, what is Part B?
Part B is going to be outpatient medical and physician services, and I'll cover that in a little bit more detail in a few minutes.
That is one thing I did neglect to say at the very beginning. Right now, we're giving you general information that applies generally about Medicare, and then we're going to go through individually A, B, C, and D, what they all cover, and then the differences between, like, say, a Medigap or Medicare supplement and a Medicare Advantage plan. So we'll go through all of that.
Enrolling in Part B, basically, if you don't enroll in Part B during your initial enrollment period, you may do so during a special enrollment period or the general enrollment period that I just described. And when you enroll in Medicare Part B, you have up to 6 months to enroll in a Medigap, also known as a Medicare supplement plan, and the insurance company must accept your application. There's no health questions. It's what we call a guaranteed issue right. And we'll go through that as a potential path, but if that is a path that you want to explore, know that you can do so within the first 6 months of your effective date of Medicare Part B. After 6 months, if you elect to enroll in a Medigap program, it's going to be subject to health questions and underwriting approval, and you could be declined.
And then just to reinforce that, this says Medigap on it. So as Mike mentioned, that's a very common phrase for a Medicare supplement. They mean exactly the same thing, but you will see both terms used interchangeably. Whereas a Medicare Advantage is a very different animal, and we'll tell you what the differences are to think about.
Yep. Now, we've talked about why people may delay their enrollment in Medicare Part B if they have coverage through an employer-sponsored plan. You can see from this chart that Medicare is going to bill or invoice you for the premiums associated with Part B based on your tax filed return 2 years prior. So for those of you who may be eligible for Medicare in 2026, Medicare is going to look at your tax filings for 2024 to determine what gradient income do you fall in. And you can see for this year, this isn't 2026, Medicare hasn't verified what those numbers are going to be quite yet, but the premium, if you were enrolled in Medicare today for Part B, is starting at $185 per individual per month. And you can see if you are a higher wage earner, Medicare is going to bill you a greater premium for Part B. It's what they call an IRMA surcharge. IRMA stands for Income-Related Monthly Adjustment Amount. And so Social Security and Medicare, you'll receive written confirmation based on your income what your Part B premium is. And Medicare will evaluate that each year. So if you're in a higher category, let's just say $370 a month, but you've then retired or your income drops during your retirement years, they're going to adjust it to reflect whatever income bracket you're in. Let me just share with you, get this question a lot. If people are subject to the IRMA surcharge, CMS has a life-changing event form where you retire. Maybe your work hours have been reduced, a death of a spouse or something of that nature. I encourage people, if you have a life-changing event and you're at a high Part B premium level, you may want to consider submitting that form SSA 44 to Social Security so that they can potentially reconsider placing you in a different premium bracket.
As Mike mentioned, they automatically, look at your income from 2 years prior each year. They reassess that. But if you have one of those events, maybe it might be unexpected. We always encourage people to file that form as opposed to waiting for Social Security and Medicare to figure out that you're not making what you used to make. So just go ahead and file that form. And if anybody wants one, we can send you one. Okay. Okay, so as I mentioned, we're going to go through all of these very high level, and then we'll do a deeper dive and take questions that anybody has on all of these different parts. So Part A, again, very high level. We're going to talk in detail about it, but that's your hospital insurance. And as Mike already mentioned, for most people, Part A, you don't have a premium for that. So when it says hospital, that means inpatient. Think of it as inpatient services. So that could be a rehab hospital, it could be an acute care hospital, but you're residing somewhere, so to speak, that is overseeing your care, and your care is being done as an inpatient. Part B is medical insurance. So think of that as outpatient type of things. So you might be an infusion center. It might be things that durable medical equipment. It might be anything that you get that's not in a hospital, physical therapy, things like that. There's a laundry list of it. But think of things that you're not an inpatient, and that's where those things are going to be covered, including physician services. Physician services or health professional services, physicians primarily, are always going to be B, even if you're an inpatient. Those services will always be B. Medicare Part C or Medicare Advantage plans. Again, very high level. Those are offered by individual insurance companies. And that actually, yes.
In Kit Carson County, we could not get an Advantage plan.
Oh, okay.
All of those who had Advantage plans were notified that as of January 1st, there are no Advantage plans
Okay.
out here.
Do you want to know high level what Medicare Advantage plans are, or do you want me to skip that? I can do it just very high
I've been
level.
dealing with it for quite a while, so
Okay.
don't worry about me. It's very frustrating because everybody talks about how great Advantage plans are, and mine was very good. I thoroughly accepted it, but now I don't have it.
Okay.
And I'm trying to figure out where to go from here. So just so you're aware, in Kit Carson, I don't know how many counties are involved, but I think it's most of southeastern Colorado.
Okay.
No longer. Yeah.
And we'll do a deeper dive about that, but very high level, these are individual insurance companies that essentially take the responsibility of bundling services and they will cover, they're required to cover what is covered by A and B. That's referred to as original Medicare. So you see if they're original Medicare, A and B. Those started before C came about, before D came about.
Okay, just make sure I understand something.
Uh-huh.
My understanding of the Advantage plans, you take C and move it to the top. They pay on it first and then A and B comes under.
Actually, A and B, the services that would normally be with original Medicare are actually transferred to that of a Medicare Advantage plan. So, whereas, and again, we'll do detail on it, but if people stay with original Medicare, those are the people that are going to potentially want to have a Medicare supplement or a Medigap plan. So, and those are very differently than a Medicare Advantage plan, where they are required by the government that what would normally be covered in A and B fall under whatever Advantage plan that is, and then anything additional that the Advantage plan has. Those plans change each and every year. The benefits of those, and we'll talk about that too, those change each and every year. And to your point, and I'm glad that you brought up that point, because Medicare Advantage plans also are required. There has to be a certain amount of providers and types of services available in a particular community for them to even exist. And so you will see, even like Denver, for example, they're going to have some Advantage plans that aren't going to be offered in Teller County or even in El Paso County or so on. It has to really do with services available and quotas, so to speak, that they have to be able to meet to even have service in that
So
area.
does that have to do with the amount of people that live in Kit Carson County?
Yes and no. The population, because of a certain population, let's just take providers and make it really simple. There has to be a certain number of specialists in this particular category of primary care physicians and different types of services. There has to be the availability that will match that of the population of an area, or they can't exist.
And I don't know this answer for sure, but if you was a state employee, like a CDOT, the para, that's what they have, and they're guaranteed their Advantage plans, even in Kit Carson County, but they're not, to buy one, I don't know.
What I was told, and Lord knows I talked to a lot of people, the Advantage plans aren't going to be offered around here because the PPOs walked away from them.
And that did happen with some of the
Yes,
carriers.
they walked away from them. So now you're kind of going, okay, what do I do now?
I will talk about that as we get into
Good.
it a little
Thank you.
bit later.
That's my concern, because
But that is one of the other instances where it may not be available because carriers can stop covering certain areas. whenever
they just walked away, they said. And it's coming up very soon that those of us, we got what, till the 7th of December?
Right.
To get things settled? And
There are large companies where that happened that are affecting everyone across the country. Some large carriers that discontinue PPO. So that's happening all over, not just, that's a completely different part of why they're not offered outside of population, and that a carrier can leave. And that's happening right now across the country. And to your point, Mike will talk about it more in detail too. Retirement type plans, a lot of retirement plans are Medicare Advantage plans. Those are a completely separate thing too, when it is the retirement plan.
Because
Okay.
you got a lot of teachers, you have like state employees that are on that, so.
Yeah, exactly. And a lot of your large companies have that people can stay on, that they can stay on it, just that it converts to a Medicare Advantage plan, but it is still a retirement plan. And then prescription drug coverage, I'll do detail about that at the very, very end. We'll talk about Part D, because this is a time right now where people need to be thinking about not just the annual election period and the different things that you can change during that time, but that is one. So I'm going to save Part D till the very end. And also, I'm going to give this to Mike. So this picture, this chart right here, you have in your packet. And on the back of that is the income chart that I had up here a little while ago. On the back of that, you have that too. And then we'll give you a couple points when we're all done about the annual election period and things that you really need to be aware of right now, and I put a flyer in your pocket about that too.
I like this chart because from my perspective, it's a simple way to share with people, here are the paths that you can take to access Medicare. In that left column, you see Medicare Parts A and B, hospital and medical. There's going to be deductibles and coinsurance associated with Parts A and B, and I'll go into some detail about that. And with Parts A and B, you have the flexibility to choose any provider, doctor or hospital throughout the United States that accepts assignment of benefits from Medicare. And approximately 97% of providers accept assignment of benefits from Medicare. So if you like the flexibility of choice in choosing providers throughout the U.S., that's available to you through Parts A and B. As we mentioned, Part A is going to be zero premium for most individuals. Part B, Medicare is going to charge a premium, and currently it starts at $185 per month. People who elect to enroll in Medicare Parts A and B have an opportunity to enroll in a Medicare supplement, also known as a Medigap plan. These are offered by private insurance companies. They charge a premium for these plans, and these plans are designed to fill in the gaps of what Medicare Parts A and B don't cover, thus nicknamed Medigap. These plans can vary in benefits, but Medicare regulates what those benefits are. So for example, if someone is enrolled in a Medicare Supplement Plan G, those plan of benefits are going to be the same regardless of which insurance company you select. They may have some special enhancements as part of their contract, but generally the benefits are standardized throughout the industry. And there may be some variance in premiums and that sort of thing, but the benefits are regulated. One of the important things with the Medicare Supplement Plan is that you have a guaranteed issue right when you enroll during your initial enrollment period or special enrollment period, meaning the insurance company must accept your application, no health questions asked. If you elect to enroll in a Medicare Supplement Plan and you're outside your initial enrollment or special enrollment period timelines, your application is going to be subject to underwriting approval and one could be declined. So that's an important point. People who enroll in Medicare A and B will also want to consider enrolling in Medicare Part D, prescription drug.
And I'll do details of those.
Yeah. There's multiple companies that contract with Medicare to offer the prescription drug program, generally going to be premiums and deductibles. But the one thing that's important with Part D is that you can change that plan every year during the annual election period, October 15th through December 7th. And Stacy's going to talk in more detail about prescription drugs. Another path is the one in the center, Medicare Part C, also known as Medicare Advantage plans. These are programs offered by private insurance companies that contract with Medicare, and they will bundle hospital, medical, prescription drug, and package them into one program called Medicare Part C or Medicare Advantage. These plans are typically structured as network-based plans, either HMOs, health maintenance organizations, or PPOs, preferred provider organizations, where one needs to utilize the doctors and hospitals that plan contracts with. Otherwise, you could have higher out-of-pocket expenses. Generally, an HMO is going to have a narrower network of providers than a PPO. And PPOs can be structured as regional or national PPOs. So depending upon what your needs are, what your preferences and priorities are, you're going to want to evaluate and determine, okay, is my provider that I'm currently engaged with and I want to retain that relationship, is he or she in that plan's network? Back up here. Okay. With the Part C plan, these plans can have out-of-pocket maximums. If you go in network, right now it's $9,350, not $8,300. And That's if you go in network. Your out-of-pocket exposure could be even greater if you go outside the network. You're still required to pay your Part B premium. So it doesn't matter which path you choose. You're still required to pay Medicare Part B. And if you choose a Medicare Advantage plan, you may not enroll in a Medicare Supplement plan. It's only designed for people who are enrolled in A and B. However, if you're enrolled in a Medicare Advantage plan and you're in the first 12 months of Medicare and you decide this isn't working for me, I want to go to original Medicare, A and B with a supplement, you may do so and you'll have the guaranteed issue right if it's within 12 months. Now, the Medicare Advantage plans are typically zero or low premium. The insurance companies will offer some supplemental benefits, maybe some basic dental, vision, over-the-counter medications, maybe a gym membership, in an effort to attract people to consider that as an option. So if that's important to you, those Medicare Part C plans are going to provide that. Now, to answer your question, if an insurance company dissolves their PPO plan, which is occurring pretty frequently, in the letter that you get from the carrier, it should identify that you have a right, if you choose, to enroll in a Medicare supplement and have the guaranteed issue. So that would be an option for you. You can also choose to enroll in another Medicare Advantage plan during this annual election period. Many of the plans that we're seeing are narrowing their plan choices to HMOs, or what's known as HMO point of service, which does give you the ability to go outside your network, but you may have higher out-of-pocket expenses. So that's available. So as we work with individuals and help them determine what's their strategies for protection, we want to look at both acute and chronic needs. Not just when you're 65, but throughout your lifetime. And so what we want to do is fill in as much of this with protection as we possibly can. And let's take a look at what parts A and B cover and where the shortfalls are. So Medicare Part A is hospitalization. Medicare is going to cover the first 60 days of inpatient care in full. However, Medicare does have a deductible in Part A, and this year it's $1,676. And Medicare defines that as a benefit period deductible. Well, what does that mean? If the beneficiary were hospitalized as an inpatient for 3 days and then discharged, the beneficiary he's discharged or she's discharged after 3 days, the beneficiary is going to pay the first $1,676. Medicare will cover the balance. Once the individual has been discharged from the hospital, if they remain out of the hospital for at least 60 or more consecutive days, and later in the year are admitted as an inpatient again, Medicare defines that as a new benefit period because more than 60 days has gone by that you were admitted again, and thus you would be responsible for paying that deductible again. So it's possible for people to pay this deductible more than one time in a calendar year, depending upon the frequency of their admittances and the duration of time in between each admittance. You can see from the chart that if someone has a lengthy stay lasting 61 to 90 days, they're paying $419 per day. Medicare covers the balance. And on stays lasting 91 to 150, beneficiaries paying $838 per day. Medicare covers the balance. Medicare does not cover hospitalizations beyond 150 days. I would define that as more like extended care, maybe nursing home, assisted living. Medicare does not get involved in those kinds of coverages. So you can see that there potentially is some significant out-of-pocket exposure. That's why people will consider enrolling in either a Medicare supplement or a Medicare Advantage plan so that there's a ceiling or a maximum out-of-pocket exposure that these plans have. Another area of Part A is skilled nursing facility care. Following a minimum 3-day inpatient stay, Medicare is going to cover the first 20 days in full. After 20 days, the beneficiary is going to pay $209.50 per day. Medicare will cover the balance. Medicare does not cover skilled nursing facility care beyond 100 days. That's going to be could be extended care type of stay, and Medicare doesn't get involved in that. Again, you have some potentially high out-of-pocket exposure if you required a lengthy skilled nursing stay, and that's why people will consider a Medicare supplement or a Medicare Advantage plan. A few other items that fall under Part A include blood transfusions, home health care, and hospice. With home health care, this is skilled clinical care. It is not personal custodial care, and Medicare is going to cover up to 35 hours per week for home health care. With hospice, if someone has a life expectancy of 6 months or less, Medicare is going to cover 95% of one's hospice-related expenses. 5% is going to be the beneficiary's responsibility. So these are the primary items that fall under Part A. If we shade in this healthcare pie with red on what Part A covers, we can see that there's still a lot of white left. And there's out-of-pocket exposure. So let's take a look at what Part B covers, and I'll let Stacy delve into that.
So Part B benefits, one of the things is the Welcome to Medicare visit, okay? And that is also considered part of preventive services, which we'll talk about. So what that is it covers in full. So these are not subject to the deductible that we'll tell you about in a moment. So they cover preventive benefits. Again, there isn't any deductible that applies to that. And so what the Medicare visit is, actually, keep in mind that that's really more of a consultative type of an appointment. You'll talk about like your health history, family health history, things like that, and determine what type of preventive benefits. So that's an important part of the Welcome to Medicare visit, is to determine what type of preventive screenings and things like that should you have in your plan of care, so to speak, which is essentially the primary purpose of that Welcome to Medicare visit. And then preventive services, we've got a couple of examples coming up about preventive services. That happens to be something that's really near and dear to my heart, because as a nurse, I'm a real proponent of people making sure that they do all of their preventive services that are recommended and are covered. And Medicare does a great job on covering a lot of preventive services. There are a few caveats that I'll bring up on the next slide. Inpatient and outpatient doctor services, again, Part B, anything that's related to physician type of services are going to fall under your Part B. Surgical services, so this is not an exhaustive list, but it gives you an idea of like what we had talked about before, outpatient types of services and equipment, and that is primarily always going to fall under your Part B. So a little bit more on the Welcome to Medicare visit. The annual annual wellness visit is actually somewhat of a replica or an update of what your very first one was, which is like what we had just talked about. You're encouraged to have that during your first 12 months. It is not a physical exam. Again, it is primary consultative. It doesn't mean that there's not other reasons for you to have physical type of interactions with your provider. Those just fall under a different coding than a preventive service, and you're welcome to Medicare visit. And so then again, each and every year, you're encouraged to update that with your provider. So preventive service is an important thing. And again, I'm going to bring your attention to, we're talking about original Medicare here. You know, if you had original Medicare by itself, there are timelines in terms of when those preventive services that you are eligible to have them done. And if they're not done within those, this is just a short list. There's a very complete list on the website, medicare.gov, and there also is in the Medicare and You handbook. There's a more thorough list. But it gives you an idea that this is when Medicare is going to cover those types of services. Okay? Now, if somebody has those services outside of when you can see the timelines here, then the beneficiary is potentially responsible for whatever that costs on any of those preventive services. So once again, that's one of the reasons why most people will look at an Advantage plan or a Medicare supplement. In fact, there are Medicare supplements, there's one or two of them out there as an example, that will let these decisions on, and there's a whole long list of what Medicare covers and preventive benefits, but they will let that decision be between you and your provider, because there might be certain reasons why your provider wants you to have a screening a lot more often than what Medicare is determining. And so there's a couple of supplement plans that are going to let that be, as long as it's ordered by the provider and coded properly, they're going to cover it in full. So it's something, again, just for you to be aware of some of the differences. Okay, so we'll talk about costs, what Medicare, again, original Medicare by itself covers and what it does not.
So with Medicare Part B, there is a deductible. This year it's $257, and it is the traditional calendar year deductible, unlike Part A where they define it as a benefit period. Once one satisfies that deductible, then Medicare is going to pay 80% of eligible expenses. 20% is going to be the beneficiary's responsibility. However, there's no co-insurance limit on that 20%. So whether you have a $1,000 medical bill or a $200,000 medical bill, you're responsible for 20%. That is why people will either enroll in a Medicare supplement or a Medicare Advantage plan, so that there is a ceiling or a limit on what your maximum out-of-pocket exposure may be. We say to our clients, we don't want an unexpected medical or health crisis to become a financial crisis. So you're going to want to have that kind of protection and not rely on Medicare Parts A and B by itself. There are some things that Medicare doesn't cover, and you can see from this list, things like dental, vision, hearing, long-term care, those kinds of things. Just be aware that there are programs that they're not going to cover. Some of the Medicare Advantage plans will have some of the supplemental benefits where they'll put some basic protection in there, and that may be, very attractive for certain individuals and within their budget and so forth. So it's a way to get some of that kind of protection. If we look at the pie chart,
And I have this in your packet too, the wheel.
If we look at the pie chart now with Medicare Parts A and B, we can still see that there's still a lot of white space left on there. So you want to look at, well, is there individual dental or vision plans? The Medicare supplement or the Medicare Advantage plans will help fill in some of these white spaces that you see. Medicare Part D, the prescription drug, will provide protection for the pharmacy. We can see in this area more of extended type of care stay. Medicare does not get involved on that. So you need to visit with an advisor who may specialize in long-term care or hybrid type of programs with your financial advisor, and they may be able to provide that kind of protection for you. So this is the Medicare Part C, kind of an overview of what I covered on the chart, but basically you're combining Medicare A, B, and D and packaging it into Medicare Part C. These plans do come with provider network restrictions, prior authorization requirements, if you see a specialist. But these plans are optionally renewable each year. But we encourage people that enroll in these plans to make sure that, are the co-payments, out-of-pocket exposure changing? Is my network of providers changing? Insurance companies can have different negotiations. You well know in this community, and so they may or may not elect to participate. And your out-of-pocket costs can and do vary over time, so you'll need to check those each year. And if you enroll in the Medicare Part C, you may not enroll in the Medicare Supplement program, or you can submit application, but it may be subject to health questions and underwriting approval. You may not have that guaranteed issue right. We'll let Part D.
And just one point, so there's not any confusion. When we talk about medical underwriting after that guaranteed issue right is expired, or that 24 months or 12 months after somebody maybe changes their mind about a Medicare Advantage plan, the health underwriting questions for eligibility after those things expire relates to Medicare supplements, not to Medicare Advantage. People can always enroll in a Medicare Advantage plan during the appropriate enrollment periods, and there's a couple of them. And that, so just to make sure that that's clear. So in the chart that we gave you, like this one right here, the 4 columns, so that you can always go to the Medicare Advantage plan, but to get a Medicare supplement plan, if it's outside of those guidelines that Mike already talked about, and you will have to do medical. So Part D. Okay, so Part D, those are the prescription drugs. This is going to come into play primarily. It actually is going to come into play no matter what you do, unless you're just on original Medicare. Okay, if you do a Medicare Advantage plan, you want to think about this in a little bit of a different way than you do if you're on original Medicare with a supplement. You're going to want a Part D plan. So essentially what these are, they are offered by your big insurance companies. And a lot of the insurance companies have more than one plan. So, several years ago, we had like 26 plans available in a lot of counties throughout Colorado, 20 to 26 or whatever. This year, there's only about 10 offered in the state of Colorado. So that changes each and every year. The plans have to be submitted to Medicare, vetted and approved before they are released for Medicare beneficiaries to choose what plan they want for that subsequent year. They all become after, and I'm talking about after, you'll pick one when you enroll in a Medicare supplement plan if you do, and with a Medicare Advantage plan. The difference with a Medicare Advantage plan is that a Part D plan, your drug plan is going to be part, generally, most of all the time, it's going to be part of your Medicare Advantage plan. So you want to make sure you really pay attention to that if you do go down the Medicare Advantage plan, that the benefits align with what your medication list is or what it might be anticipated to be the rest of that year. So that's just an important thing to know. Don't neglect that, because sometimes people can be surprised if there hasn't been a thorough evaluation and they find out after they've enrolled that some of their medications may not be covered or may not be covered the way they were anticipating it would be. Whereas if a freestanding Part D plan with a Medicare supplement plan, every year at the time you enroll, and then each and every year during what we're in right now, the annual election period, you have the opportunity to reevaluate those plans. And when I'm talking about how you pick one and what you're going to evaluate each year, is every single one of the plans that is offered to beneficiaries is going to have a monthly premium and a deductible. So that's the first thing to know. This year, the monthly premiums are ranging anywhere, I'm talking about 2026 now because we're really helping people pick those out. And that's one of the things that I do, is that they're going to be anywhere from $0 to about $130 per month, okay? And then the maximum deductible, drew a blank, is $615 for 2026, the deductible. So it's kind of like other types of insurance. Usually your lower premium plans are going to have a higher end deductible, and then vice versa. Although I will say that there's only 10 plans available this year in 2026. A lot of them are the 615. Even some of the higher premium plans still have a pretty high deductible this year. So those are kind of things that matter. And then the zip code in which you live, your county. Usually within the state, you're not going to see big differences in what's offered or prices, but state to state, you will see dramatic differences. So the Part D plans, the most important thing is what your medication list is. So be as accurate as you can. If you're going to assess it yourself, and there's a plan finder on Medicare.gov each year that is open to consumers, you can compare all the different plans. It's pretty user-friendly. Or you can have somebody help you do it, like I help anybody that wants assistance on doing that. You want to say again?
I think it's just your computer keeps going.
Oh, it's that.
Just Google.
Here, I'll get it.
I don't, you guys might be licensed to do this, but there is some government programs that they'll actually fill out the deed for you.
Yes, yes, there are, and SHIP will help people with that, and there's actually representatives from Medicare that will do that as well.
I didn't get a choice with the D plan.
Well, see, that's the thing, with the
Medicare did
Medicare
it for
Advantage
me.
plan, it's going
Did
to be what is married in with that, it's gonna
Yeah.
be embedded in that bundle of services.
Medicare enrolled me in a D plan.
Okay,
Just, I got a card in the mail that says you are now,
oh, okay,
and,
I like that program. Somebody else does.
okay.
well, after investigating it, I did too, but if it had been something I didn't want, I'd have backed off of
It's
it.
really important, and obviously everybody can make their own decisions, but I will just say from our perspective, if you're on a Medicare Advantage plan, you want to reevaluate each and every year, because they can they can change their plan design down to every benefit that they offer, and they do. Same is true with a Part D plan, whether we're talking about a Medicare supplement with a D or with the drug coverages with Medicare Advantage. They change their plan designs every year. I cannot tell you how many people we send everybody a letter of our clients every year to remind them it's this time of the year. We'll hear, oh, my medicines are the same, there's no change. Oh, that's all fine, but they can change. Their level of coverage can change, their premiums, their deductibles, what they cover. That's the biggest thing when I say your medication list, how it aligns with the formulary of each one of these plans. Every plan does not cover every medication by any stretch of the imagination. And some are going to be covered with some plans, and some are going to be covered with others, and some aren't going to be covered by any of them. So you want to know that before you make those selections for the next year. Because if you don't do it during the annual election period, you are stuck where you are. It will auto-renew, and that's what you have. Unless you have some sort of a special enrollment period, you can't change your Part D. So it's a really important thing. I mean, there are people that spend thousands and thousands of dollars a year on their medication. Other people, not so much. So that's why there's a lot of different plans to choose from. But if you remember nothing else, is a really good thing it's a necessary thing from our perspective to reevaluate that each and every year. The other thing that is new as of last year, and some of you may have experienced this, is that for the first time ever, there is actually a cap on what beneficiaries are going to spend out of pocket on their prescription medications, which we've never ever had that before. That was part of the Inflation Reduction Act. So, you remember a few years ago, insulin, there was a cap on insulin costs. And then some of your brand medications that were really, really high in cost, there was a list of 10 of them in 2024, that the prices got reduced 2025. There's another list 2026, that there will be another list of some of those really expensive brand medications. But overall, what you spend out of pocket is capped at, in 2026, it's going to be $2,100. So no matter how much your medicine costs or what your evaluation tells you, you won't spend more than $2,100. As long as, and this is the thing, as long as that is a covered medication. Like I said, every plan doesn't cover every single medicine, and it'll show you on whatever the system that you use if it's a covered medication or not. It has to be purchased within your Medicare approved plan, and it has to be on their formulary. It has to say, it can't say, even if you buy it through your Medicare approved plan, if it says it's a non-covered drug, it is not going to count towards that $2,100 cap. And some people don't realize that. They think, well, I'm going to use my, GoodRx or whatever for these because it's a little bit less expensive than there. That will not count. So just keep that in mind. That cap, it has to be purchased within a Medicare approved plan that you enrolled in, and it has to be a covered medication. And now it doesn't, and when we say out of pocket costs at $2,100, and I'm spending a little bit more time on this because right now this is things that all of you should be considering because of the annual election period too, is that $2,100 doesn't mean just what you, out on your credit card or what you pay cash for your medicines. It does, all of that counts. But also what the Medicare insurance plans are actually contributing towards the covering of your medicine, that counts too. So, it can add up a lot faster than what you realize. And your account will tell you that.
Yeah, I have a wife that has taken shots daily.
Mm-hmm.
that shot, if you have to pay it out of pocket, it's $4,500 a month. I did go through a period of time trying to jump from the state to get on insurance. It cost me $1,200 a month. So,
There are some medications out there that are just.
but we did recently get on D, and that was one of them they asked for, and they will cover it. So.
And there are some, and I will tell you, there are some that nobody's known in certain categories. All these plans generally, there are exceptions, but generally they all have to have a certain number of medications in every single drug category on their formulary. The formulators are going to differ, not just by insurance company, but by a plan. So they're going to vary. But what the ones are that they choose to cover are going to vary plan by plan. So questions on any of that? I have a little checklist for you about the annual election period. Just things that I think we've touched on most of them, but just kind of a little trigger for you to remember. The most important thing is evaluate what you have and make sure that you pay attention to what was sent to you. That they're all required by law to send you what's called, it says ANOC on it, annual notice of change, to tell you what things are changing, but that's at a very general level. It doesn't necessarily look at every single specific thing that's relative to you. So you want to evaluate each and every year and make sure that before December 7th, that what you currently have, if you like what you have, that it's what's going to change. And is that still an optimum fit for me? Because if it's not, you have options to make changes, and now is the time. Now is the time to do that. Yes.
If you're already enrolled in Medicare and you have Part A and Part B, but you'd like to add Part D, is there a penalty that you have to pay?
Well, yes. If you've never had D before, then yes. And there's an algorithm for how it's figured out. It's not going to be as much as it would be with B, but there is a penalty for D as well. And it's calculated by what the average premium was in that particular year that you're enrolling. It's 1% of that. And then it's calculated by how many months and time that you did not have it. And then they will add that. To what your premium is. And it stays with you. You never get rid of it.
The national average was between $34 and $35 in monthly premium. So
It was 32 cents a month it was added.
So if you apply 1% times the national average monthly premium of $34, $35, you're looking at, between 30 and 35 cents times every month you were without the coverage is what's going to be added to your base premium of the Part D plan that you enroll in.
And it will stay. It will stay with you. If you really do want to calculate it, there's a chart in the Medicare.
So if you've had Part A and Part B for quite a while, that's going to be a pretty substantial penalty.
It could be.
It could be. It just depends on how long you've been without it.
Yeah.
The other thing is, too, along those same lines, if you had a Part D plan and you let it expire, if more than 63 days goes by before you re-enroll in a Part D plan, you will start accruing a penalty as well, if more than 63 days goes by.
So my question is, from what I'm reading, there's no supplement Medicare that will cover the medication, just the Part D? Or is there supplement plans that will cover medication?
If it's a Medicare supplement happen, you would add a Part D. You would add a Part D plan. So supplements do not have coverage for self-administered medications. Anything that's administered in a physician's office or like let's say an infusion center or where you go someplace or a health professional is administering it to you, regardless of where you are, that falls under original Medicare Part B. So but pills, things that you take at home that you go to the pharmacy and take, those are Part D. Those are Part D related. Now there are plans out there. Again, there's different. There are zero premium plans, for example. So we will have people tell us, well, I'm not on any medicines, or my medicines are so cheap. I don't want to bother with it. Well, you know why? You always want to have a plan, regardless if you're on any medicine or if they're, quote, really inexpensive, because there are plans that are zero premium. And some of them, even on most generic medications, there is an equation for them. But just so you know, there are people that can be on a whole lot of medications and still not really pay anything, or non what they pay and no premium. So that's why looking at your medication list and how they fit with all the different plans. And it's a pretty simple process. And like I said, if anybody wants help, just let us know. But it's a pretty simple process. But a Part D plan doesn't have to cost you a lot or anything sometimes that you want to have.
So if I'm understanding it right, a Part D is basically a supplement.
No.
No, it's actually an insurance, it's an insurance product. It is offered by, all your major carriers, not all of them anymore, it used to be, but carriers, and they have specific plans that are approved, they're vetted and approved by Medicare, and they're available only to Medicare Part D plans. So like even if it's an Aetna plan or, or whatever it is, those insurance companies, it's going to be an insurance plan. Okay,
So every year you want to dig into what program?
like what your plan design looks like compared to everything else.
Okay.
So that because you can change it. And it's a simple enrollment to change. It takes like 5 or 10 minutes to change it because you just want to see. Because what'll happen is they're going to change their plan designs each year. So as as I was saying before, they might eliminate a plan, they might add a plan, they might consolidate plans. So you want to know what you're going to have the next year, and it's really, really important because it cannot be a very big difference, or it can be a dramatic difference.
This chart is in that Medigap purchasing guide, but this is just a high-level overview of the different Medicare supplement plans that are currently available, and Medicare defines them by a letter, and you can see that the benefits are going to be standardized with whatever plan you enroll in, and you can look at what is the out-of-pocket exposure. Just for the purpose of our discussion here, Plan F is not a plan that is offered anymore unless you were first eligible for Medicare prior to January 1 of 2020. Plan F covers all eligible expenses not covered by Medicare Parts A and B. There's virtually zero or very little out-of-pocket exposure. Another plan that is available, Plan G, is a very comprehensive plan. It covers all eligible expenses, except it doesn't cover Medicare's Part B deductible, which currently is $257. And so, depending upon your budget, what kind of risk tolerance you have, whether you're a low or high utilizer of services, if you go down this path, there's different plan options that one can evaluate and select from. So with Medicare Parts A and B, there's no annual limit or out-of-pocket exposure if you just rely on Parts A and B. You've got the 20% coinsurance, and so again, you'll want to consider either a Medicare supplement or a Medicare Advantage so that there's a ceiling or a limit on what your exposure is. And basically, you have these as your options. You can enroll in original Medicare A and B. You can add a prescription drug plan. You can combine Medicare A, B, and D with the Medicare supplement, or you can go with a Medicare Part C or Medicare Advantage plan that combines hospital, medical, and prescription drug. If for those people who are eligible for TRICARE for life, TRICARE will serve as your supplement plan. And so you enroll in Medicare A and B. If you're getting prescription drugs through the TRICARE program, fine. You can also enroll in a Part D plan if you so choose and feel that is important. But the TRICARE will act as your supplement to Medicare A and B. We encourage people, if you haven't already established my Social Security account online, we encourage people to do so, and that way you can enroll in Medicare And also, obviously, monitor and track what your retirement benefits will be when you do start claiming Social Security. And our focus for Stacy and I is really just to help people optimize Medicare. We focus on education. Once you know which path best aligns with your priorities and needs, then we focus on specific carrier solutions that address your needs. And as Stacy mentioned earlier, one size doesn't fit all, and we want to understand what it is that is going to best meet with your needs. And I think
I have one quick question. It's a
Yes,
little
sir.
it's a little different. If a person's on disability and they have A and B.
Yep.
How or can they, is there someplace you can go to get, like a supplement insurance for that 20%?
once, you can work with an agent, you can go directly to a particular carrier, but once you have been receiving benefits for 24 months, you are then able to enroll in a Medicare supplement plan, and the insurance company must accept that application if it's right after 24 months. You will also, I didn't mention this earlier, but if you're not 65, you will also have another initial enrollment period when you turn 65 if you're already claiming benefits from Medicare and enrolled in the supplement. And that's important because the insurance companies will have a significantly lower rate associated with that Medicare supplement when you're in your initial enrollment period.
Let me back up. I didn't tell you quite the whole story. She's 40 years old. She's on disability.
Okay.
Because she has massive migraines.
Okay.
She has A and B, but she's not able to cover the 20%. And that's what I'm looking.
That would be the supplement. So when she is getting to the 24 months of receiving SSDI, then she'll want to submit an application or at least review the different Medicare supplement plans and the premiums associated with that, but the insurance company must issue that policy.
Thank you.
Mm-hmm.
And you can get that referral or that form on the Medicare.gov site?
Well,
Or how
when
do
you submit
sign
the
up?
application, they're going to want to see proof of when, on a copy of her Medicare ID card, when was the coverage effective, and then you'll want to initiate the supplement, to be within 6 months of her becoming eligible for Medicare Part B.
Okay.
After 6 months, then it's subject to health questions and underwriting approval.
Well, she has A and B, but
Okay.
this other's.
So look at the red, white, and blue card. When was Part B effective and Part A? And if we're within 6 months, then she's got that guaranteed issue right for the supplement. If it's after 6 months, it could be subject to health questions. The carrier may charge a greater premium and that sort of thing, but you would need to look at that.
Thank you.
Mm-hmm. Anything else? We're going to stay for a bit. If people have questions that they want to ask us individually, that's fine. If you want to schedule a consultation, Stacy and I do these at no cost, and we're happy to. What I like to do is typically a discovery call for 20 minutes so I can get some basic information about you and your current coverage status, and then we can do our research and then schedule a meeting, virtual or whatever.
So if people are online, I guess you could put it in the chat too. That's our contact information right there. And those of you here in the room, we have these on the table. Our website's on there as well as our email addresses.
Yeah, we link your information to your.
I figured.
Thank you.
So we do have a follow-up question to the chat from before. It says, My husband turned 65 last January. He is enrolled in my retiree health coverage. UHC kept denying his claims because they said he must be on Medicare. I finally tried to enroll him in Part B during a special enrollment period. Then was hit with the credible coverage question that implied he wasn't eligible since he was a retiree plan. He's a farmer. So we enrolled him and we will pay a penalty and they are delaying his coverage until February. Now I need to know how to make sure he has Part B.
Part D. If the retiree plan is a Medicare Advantage plan, they will likely have a prescription drug benefit as a component of that. If it is not a part, if prescription drug is not a part of his retiree health benefit program, then he needs to enroll in Medicare Part B between now and December 7th, so it'll become effective on January 1.
Yes.
I feel like I have lots of stupid questions.
No,
There is no
there's
stupid question.
a lot to
I've
know.
probably been on it longer than most of them around
There's
here.
no stupid questions.
I am having to pay a penalty. I had a prescription plan when I first moved out here, and I didn't know that it was anything other than just an insurance policy for my drugs. Never used it, because at that time I was undergoing chemo for breast cancer, and my drugs were just sky high, and they didn't pay anything. So I just canceled it. Now I'm having to pay a lifetime penalty because that was involved in Medicare?
If you did not have credible prescription drug coverage, and now you are enrolling in a Part D plan.
Yep.
Or another Medicare Advantage plan that has prescription drug as a part of that package, they will look at the number of months you were without credible prescription drug coverage and apply that penalty on top of whatever you might be paying if it's in a Part D plan, or maybe zero premium in a Medicare Advantage plan, but they will assess that late enrollment penalty.
So if I go for a medical supplement plan, which I'm leaning towards, they will charge me what
No, Medicare
United
will.
Health was charging me?
No.
Your Part D plan, your drug plan, it'll be added to the.
It'll come from the drug plan.
Yes,
Yeah.
Medicare will bill you whatever that calculated penalty is on top of whatever base premium you're paying for Part D.
I can't argue there because it's only $24. It's just that it gripes my soul that every month I have to pay that.
Right.
When I didn't know
I understand.
that that's what was going to happen. And I guess you can attempt to get that resolved and removed, but
I haven't heard of it being, unless you can prove that you had credible prescription
considered
drug coverage.
credible.
I haven't heard of Medicare removing that penalty.
yeah, well, at that time, nobody knew about that kind of stuff. I'll be very honest, nobody knew about that kind of stuff. And the agent that sold me the prescription deal never said anything about anything that would happen. It wasn't doing me any good, and I was paying money for it. It never paid for any of the drugs. I don't think. It never paid for any of the drugs I got. I even had one that was like $2,200 a pop, and they never paid for it. So,
I can understand why one would give it up, but unfortunately, no one shared with you what the ramifications would be by letting that go.
well, as I said, Medicare automatically put me in a Part D plan not too terribly long. Well, when I started calling around trying to find a replacement for my Advantage plan, they put me in well care,
Yep, well care.
which I understand is very good, and it's what I should be in.
They have two different plans. They probably put you in WellCare Value Script. This is $0 premium.
$2 a month.
Okay, so it's a WellCare Classic. It's still the same company and they have very decent ratings.
And-
Very different.
So who's going to bill me this penalty I've been paying? Who's going to tell me I have to
So
pay that?
Social Security or Medicare is going to determine what that penalty is and assess you appropriately. If you're having Part B premium deducted from Social Security retirement benefits,
You mean D. She's talking about
right,
B.
but now that she's enrolled in D, they'll determine what that is and deduct that from your monthly retirement.
But it'll be added to your Part D premium. So if
Right.
it's $2.20, I
26
think it
bucks,
is.
I mean, you know.
So that, whatever they calculate as the penalty will be added to that $2.20.
So is this the same thing that I've been paying all along? The penalty?
Yeah.
Is it, I mean, I'm not gonna have to pay this $23 one plus a $24 one? When,
They're going to determine from the time you dropped your Part D coverage to the time you now are enrolled in Part D, they're gonna look at how many months were you not covered by a credible prescription drug plan. And they're going to apply a penalty equivalent to 1% times the national monthly Part D premium average for that period of time that you were not enrolled, and that is what they're going to determine as your total penalty.
Can I interrupt a minute, if you don't mind?
no,
What she's wanting to know is who's gonna send her a bill? If I understand you right, it's gonna come out of her Social Security benefits.
Correct.
That's what you're wanting to know, right?
so see, right now, until January, I guess, I have to send $23 and change. And I forget who I have to send it to, but I have to pay that every month.
Mm-hmm.
So now that I've got Part D, they said that I would owe them $24 and change. So does the $23 one stop and the $24 one start?
Yeah,
Or am I looking
It sounds like, if I'm interpreting correct, that you've already been paying that $23 that you're referring to
Oh, yes,
is your penalty.
Yes,
But it was the penalty for not having enrolled in a prescription drug plan through Medicare. Is that correct?
Right.
So you've already been incurring your penalty. So it's already been calculated. That will now be part of your Part D plan instead. You'll get one penalty. They're not going to add a second penalty.
She's not gonna answer
And
She won't have to pay
and
anybody.
it depends on
It'll
how
come out of
you
her Social
pay your
Security.
premium. So
Sure.
a lot of
That's when
people do have it deducted from Social Security, but you don't have to. If that's how you choose to pay for your Part D, it'll come out of your Social Security just like the premium for your D. So it just depends on how you pay for your premium. And if it is through Social Security, it'll be added there.
I don't think it ever came out of Social
And
Security.
then
It
it'll
was-
be added however you choose to pay your premium for your Part D. So a lot of people have it deducted from Social, but you don't have to. So however you pay your premium for your Part D plan, that is going to be the penalty that will be added there.
And for whatever it's worth, that would come out of your Social Security because for taxes, you're getting taxed on less dollars. Does that make sense?
No, that's why it's clear.
What I'm saying is-
But I understand what you're telling me.
Yeah.
If you get paid $2,000 for your Social Security, just say it, and they deduct $23 off of that, so now you're getting $1,975 Social Security. That's all you're paying taxes on, not the full 2,000.
Okay.
Just saying.
It's about going through this. I keep thinking, geez, have I got Alzheimer? Because it's like nothing is making sense. And trying to settle on something, I mean, I loved my Advantage plan. And it worked for me, and I had very little out-of-pocket payment. Now that's not available to me, and I've got to go to a supplemental plan, and I'm being told it's gonna cost you this, and this, and this, and this, and you have to have this, and I'm going, how did I go from not owing anything? I didn't even have I think you call it a premium that I had to pay every month, to now I've got almost $300 that I've got to pay. And I'm thinking, where do you come up with it? That's it. So I'm trying to figure out, this was bothering me because that's almost 50 extra bucks I'd have to come up with if those two.
You'll have one.
Right, I only have the one. Okay. I can handle that.
And
It's
all
very
supplement plans are
frustrating.
not going to be over 3/8. Supplement plans, there's many different types of supplement plans. It depends on what design that you choose that fits what you want. The premiums are there will be a premium, but there are ones that are as low as
The one
$50
that they set up for me was a supplement, and it was an N plan.
Oh, and, okay.
Plan N,
I liked what I saw on the N deal there.
yeah. Plan N is similar to Plan G, except that it's gonna have a $20 copayment for every physician office visit and $50 for emergency room. And it doesn't have a foreign travel, it does not have the excess charge. Participating physicians can treat Medicare eligible patients, and some can bill up to 15% greater than the Medicare allowable charge. Some supplement plans will cover that 15%, Plan N does not, just so that you know.
Yeah, well, I go to Colorado Springs for one doctor, I go to Lone Tree for another doctor. It's every penny counts.
Right.
When
And
did you get put on, because the PPO that you were on is going away January 2026, correct?
Yep.
But somebody's already enrolled you in a Medicare supplement.
yep, all I
But
do
they
is,
enrolled you, did you know what your options were? I'm just curious.
actually, I got it through, I've been with United Health. This supplemental is with United Health.
Okay.
So I know some of what's going on, not everything, but at least it's about as clear as mud. The same doctors that I was using before, of the two, I have both of them back. My oncologist is back, and the cancer dermatologist, both are back.
Any provider in the United States that accepts assignment of benefits from Medicare, and over 90-some% of them do, will take your supplement. No matter what state you're in, no matter where you get services,
Cool.
no matter what, as long as they accept it, sounds like they do, then it doesn't matter where you get, whatever provider you want to go to, as long as they accept assignment from benefits from Medicare, your Medicare supplement is going to.
Thank
We'll
you.
cover that.
You answered my question. Didn't mean to take up all
No,
of your guys' time.
I'm sorry, I was not trying to
No,
mix
no.
up your world either.
No,
because
you're not. That,
I'm just
it's,
You've been through it.
there's nobody to help. I mean, there's nobody like you guys out here that we can get to. They say,
Right.
talk to an insurance agent that deals in this.
We cover the entire state, and we can help anybody. We can help anybody.
I do have to say, I thank you for coming to present this, because it's like you retirement, you're on your own, figure it out.
But actually,
It can be very confusing. There's a lot. That's what we tell people, there's a lot to know, don't ever feel stupid, as you can see, there's a lot to
Yeah.
know. And sometimes you can reverse your decisions, and you can tell now by the timeline, sometimes you can't.
I happened to be on a phone call from a gal in Louisiana or something. She sat down and explained the different Medicaps manages to me on the phone. I didn't know that. None of that.
That's why we're independent.
Yeah.
We represent every major company you can name. Because it shouldn't be about an agent calling you, and I'm not dissing any person, but if it's somebody that's representing Humana, they're gonna tell you about Humana plans. If it's somebody that is actually what is called captive, they're gonna tell you about the plans that they represent. That's why we do what we do, because it's important to us that people know what their options are.
See, that's what's nice about you being independent. You're looking at all these companies, not just this one company.
Right.
And that gives you options.
I learned things today that I would have never learned if I just had done what I did. Fortunately, I was familiar with the
And a lot of people do that
company.
because they don't know.
It's
You
so
don't know what
bad.
you do until you're kind of immersed in it, and, and like I said, and it's unfortunate, but really almost half of people take their advice from a neighbor, whatever it is, somebody that's not in the industry.
Well, that book he's saying, it's nice to read and all. I'm not a reader. It didn't have enough pictures.
It's one of those cases where do we turn? Where do we go for help?
We're out here.
Yeah, we're out here and there's,
They're here.
yeah,
Yeah.
I have a question, so,
And we deal with, like I said, we're licensed in 14 states. We have clients in other states too. So we do Zoom calls, we do phone calls, and we go all over the state of Colorado.
so what happened to me is I turned 65. I enrolled in Medicare. Unfortunately, like everybody else, I didn't really know what I was doing. And I got signed up for A and B. I have insurance here through my job, and I really don't need B. I just turned 65 in October. Is there a way to get the B removed?
You would need to contact Social Security, administration, and,
That 1-800 number?
and elect to disenroll in Part B.
I want to make a
Just
suggestion to everybody, because I
It's
went
going
through
to
this.
be just like you're enrolling, you can call them, and a lot of them still make appointments if you want to do it in person, not all of
No,
them.
that means I gotta go to Denver. We can't do it.
So then you can do it online, and
But
then,
wouldn't it benefit her to stay on it? Because wouldn't
I
that,
got a huge bill from Medicare,
yeah,
wouldn't that be, oh,
like
Well-
$555.
if you have what's called credible coverage, and it sounds like you do, because there are things that are not credible, like individual plans and so on. Most large employer-sponsored plans are going to be credible. And so to answer your question, is because most of those, the medical part of that is going to cover, if the coverage, you're satisfied with the coverage, you don't need B. And B, one of the reasons people won't take B when they have that type of an insurance is because you pay that premium for Medicare Part B.
And
Whereas you
said-
don't have a premium with A.
You said it was like 187 or something like that.
185 is,
So why did I get a bill for 555?
Because they bill you 3 months in advance unless you can go online and change that.
Okay.
You can go online and pay it monthly if you want.
Medicare will invoice you quarterly in advance for Part B premium unless you set up an account on the Medicare.gov site and establish whatever checking or savings account that you want premium payment.
I
That's
I
really
do
easy.
want to make a comment, because I went through this. I work for the state of Colorado. I was waiting for my termination letter from the state so that I could get my B, because I was the same way. I had insurance through the state, the whole thing. We floated 2 months with no insurance until that got there. And the problem we had was things. The letter from, my wife was on it too. The thing is that the letter from the state kept getting sent to Social Security and kept getting put in my file. So she floated 2 months with no insurance until they finally figured out that letter is in my file. And so there's problems trying to get switched over.
Well, one thing I don't have an explanation for why that happened.
Oh, I
You
do.
But typically it's not required to have a termination letter to enroll in Part B.
Well-
What they will ask for when you enroll in Part B is they will want, and every company's HR should know this, they will want proof
of credible coverage, that you had credible coverage up until that point. That is typically the only thing that is required to enroll in Part B.
And I said that wrong. It's not a termination letter.
Okay,
It's when my last day of employment was. Because that's when my insurance drops too.
right. That's
And the
usually
thing
just
is-
the date you enter. They don't need, I guess what I'm saying, I can't explain what happened to you because I've never heard of it, that it actually a piece of paper saying when your last day of work was. It's just the proof of the credible coverage up until that point that is required.
Well, give you an idea, I was on Paracare Advantage, is what we were trying to go to. And because it just was, it looked like a great deal, but I was wrong. But anyway, until they wouldn't give us the insurance until our B came. And until they got the letter stating this is my last day of coverage, my last day of employment, whichever it was, and then I could get my B, then I could get my insurance. And there was this floating time in between that we were flying.
In order to be enrolled in a Medicare Advantage plan, whether it's through para, whether it's a Medicare supplement plan, or whatever, you must be enrolled in Parts A and B with it active and effective. And so if there's a delay in getting enrolled in Parts A and B, and then you're an example of that, they're not going to issue that coverage until you show proof that you are enrolled.
But typically, you don't have to have proof of termination to enroll in your B. You have to have proof of credible coverage.
Right, but this is if you were after 65, but but that's.
And that's probably, that was the letter. It was a proof of, had coverage to this day, credible coverage. And of course, they had really state CDOT, they've had great. And we made the mistake of, because my wife was also impaired because she was with the school system, she got a 20-year discount that was unbelievable. So we jumped on it. Yeah, when we figured out what Advantage was about, no.
So I'm 70, I will be on my next birthday, and I have the employee insurance. So I need to get on B so I don't get penalized. But it's gonna be a $500 and some thing to sign it up.
It's based on, like that chart that we showed you, it's based on what your income, what your filed income was 2 years prior. So like this little chart right here, it'll show you, plus you can look online.
The one where you're under 100,000. Randy, you make 100,000?
I do.
Okay, I'm sorry.
Gee, I wish 100,000. Man, that
I don't
would
think I made that in my lifetime.
I don't think I
I don't make that with wife and I together.
Yeah.